this is our presentation for heart failure. My name is Bella.
And I'm Crystal.
I will be the nurse and the nurse practitioner.
And I will be the patient.
May I come in?
Yes, come in.
Hi, my name is Bella. I'll be your nurse for today. Can you please confirm your name and date of birth?
It's Crystal Ann, 37/1998.
Okay, perfect. What brings you in today?
So, the reason why I'm here today is because lately I've been feeling like very tired. I've been really out of breath. I also noticed that my legs, especially my ankles, have been very swollen. And at night I have such a hard time sleeping.
So when you mean that you're having a hard time sleeping, what's going on at night?
So lately I've been having to use 2 pillows to kind of like alleviate myself, like kind of my heighten my posture, because I feel like if I lay down I'm gonna like suffocate.
Okay, so you're feeling like there's something on top of your chest, like something very heavy.
Something very heavy.
Okay,
yes.
and the pillow is helping you kind of expand your chest and
Yes.
breathe better?
Yes, ma'am.
Okay, perfect. I'm gonna go ahead and do an assessment on you. Also, when it comes to your edema, or your swelling in your ankles, how often do you see that?
You know what? I usually see that. Lately it hasn't been too bad, but now like even on my simple activities of like doing my chores or exercising, walking around with my friends,
Okay.
it's been swollen every day, like all day.
Okay. Are you taking any medications that we should be aware about?
Just aspirin.
Aspirin? Okay. I'm gonna go ahead and take your vital signs, and then we'll go ahead and do your assessment, and we'll talk to your nurse practitioner, and see what's going on. Okay?
Okay, thank
Okay.
you.
Hi, Miss Lan. I'm back. I'm gonna go ahead and take your vital signs and do your assessment. So I'm gonna go ahead and do your BP. So I'm gonna use this arm. You're gonna rest it, and I'm gonna have you put your feet flat on the floor and your back on the chair. Okay. Okay, so your BP is 158/86, so it is pretty high. Your pulse is 180, 128. Oh my God, it is pretty high. I'm gonna go ahead and have you put your hand on your chest. Okay, your respiratory rate is 36, and your your temperature is 87.8. That's normal, and I'm gonna go ahead and take your O2 set. It's 94%, so it's a little bit below what we want, or the ideal oxygen level that we want. I'm gonna go ahead and do the assessment, and then again give this information to the nurse practitioner, and then she'll go ahead and discuss with me what we will be doing. And I'm gonna listen to your heart, and then I'm gonna go ahead and assess your lower extremities, and I'm gonna see how much swelling you have. Okay?
Okay.
Go ahead and take a deep breath in and out. Go ahead and check it on your breath. Go ahead and take a deep breath in and out. Okay, I'm gonna go ahead and assess your heart. I'm gonna fit in the middle, okay? For 1 whole minute.
Lubdub ta. Lubdub ta. Lubdub ta.
Okay, so you do have diminished breath sounds, and I am hearing a third heart sound. Again, I will be discussing this with the doctor. I'm gonna go ahead and assess your legs. Okay, so now I'm gonna be assessing your legs, and then, okay, yes, +1 edema. Okay, I'm gonna go ahead and let your nurse practitioner know. Hello. Hi, my name is Bella. I'm gonna be your nurse practitioner. I did talk to your nurse, Bella too. And we did discuss like what she heard. She told me that she heard a third heart sound. She did explain that she saw some edema in your lower extremities. We did do some labs, and your chest x-ray is showing some mild left ventricular hypertrophy, meaning that the part of your heart is actually growing because it's just working so much.
Okay.
So we are considering that this might be left-sided heart failure. I wanted to see, do you smoke?
Yes, I do.
Okay.
I smoke like 1 pack per week, and I've been smoking for the past 10 years.
Oh, okay. So that is a risk factor. Smoking, being overweight, being obese, hypertension, which I know you also have hypertension. Your BP was pretty high as well. She did let me know. We're also seeing, again, your hematocrit, your hemoglobin, they're a little low. So we are going to keep a lookout in your labs. So what basically heart failure is most common form is left-sided heart failure, which is what we're seeing. It's a backup of blood in the upper left side of your heart, and it goes back into your lungs. It can increase pulmonary pressure, and eventually it can cause pulmonary edema, meaning that we can hear crackles in your lungs, and you'll have basically liquid in your lungs.
Okay.
Do you have any questions so far?
So, like, what can I do to, like, help, like, are there any medications I can take?
Yes, so the interventions that we're gonna go ahead and be doing, we're gonna be giving you 3 medications. So we're gonna be giving you captopril, which is basically gonna help manage your hypertension, your heart failure. We're also gonna be giving you hydrochlorothiazide, which is basically a diuretic that's gonna help alleviate some of the stress that your heart is taking, because we want to decrease fluid in your blood. That way your heart is not pumping as hard and it's not getting as stressed. So that's going to alleviate some of, again, the fluid in your body. So it's going to help with your swelling, and it's going to help with your hypertension as well. We're going to be giving you potassium with that, just because potassium can tend to decrease when you're taking this type of diuretic.
Okay.
I am going to go ahead and give you a referral to an occupational therapist and a physical therapist, so that they can go ahead and help you manage to exercise and help you, like, create a regimen for you.
Okay.
There is surgery that can be thought of.
Okay.
One of them is coronary bypass surgery. Obviously, we'll talk more about this to see if that's something that you want to go to.
Okay.
We would first try the medications, and then if this is not helping, we will then go ahead and do a more invasive procedure like the surgery for coronary bypass.
Okay. No, sounds good.
Okay, thank you.
Thank you and bye bye.